You are watching the DocTalk show.
Insights from a malaria specialist, Dr. Maya Lugemo.
My name's and I'm a malariologist. As far as we are concerned, malaria is a disease, a manifestation of a result of an infected mosquito bite into humans. Of course, it manifests with a lot of symptoms, but fever is the main cardinal symptom. Fever is the main complaint of any patient, but there are other associated symptoms like headache, joint pains, loss of appetite, diarrhea, vomiting, and to some extremes, especially in children, convulsions, loss of consciousness, sometimes delusions, and so many other manifestations. Well, just like it takes most of the blunt in HIV, if you looked at the map of Africa, HIV is more rampant south of the Sahara, around that area. But also poverty is around that area, low education, all these things that really come, because malaria is both a disease of poverty, ignorance, and other manifestations. Quite a good number, and actually giving you statistics. In Uganda until recently, about 63% of all children under the age of 5 in recent times until around 2009 to 2014, 63% of the children under 5 had parasites in their blood. And the national average of prevalence of malaria was, until recently again, 43%. So if you examine 100 people, Ugandans, on the street, 43% will be moving around with parasites in their blood. Well, I think we are very lucky, given the fact that actually malaria, for example, in Uganda, the statistics have been gruesome. Until recently, about 3-4 years ago, we were losing almost 300 people per day. Right now, as I talk, we lose about 16 to 20 per day, which means we've reduced very, very tremendously. So imagine the 320 persons dying a few years ago, about 5 years ago or so. Out of those, the children and pregnant women were mainly the most vulnerable people. There's what we call the intermittent preventive treatment in pregnancy, IPTP. We shall not use the medical term like sulfadoxine, paramethrin, but it's fancy that you can buy it off counter. This is the drug that a pregnant woman, after the 13th week, that is, after the first 3 months, every 1 month you give a dose of 3 tablets of Fansida. You encourage all pregnant women in a malaria endemic country like ours to take 3 tablets of Fansida after the 12th week, that is starting with the 13th week, with every 4 weeks, that is every 1 month apart. A pregnant woman should take 3 tablets of Fansida to prevent those parasites from embedding themselves into the placenta. As a government, as a ministry, as stakeholders like MAPD and so on, we give out nets to every pregnant woman. As soon as you attend and you start attending antenatal, that very day you attend antenatal, we give you a net and encourage you to sleep under that mosquito net. Unfortunately, some mothers do get the nets in the first maybe 3-4 weeks of pregnancy, or even in the first 3rd, 4th month. They keep the nets until they deliver. No, this is wrong. The moment you get that net, start sleeping under mosquito net. Basically, the role of the Ministry of Health under the auspices of the National Malaria Control Program, together with partners, we have a goal to have a malaria-free Uganda by 2030. That's the goal. Actually, by 2020, we should have reduced some of these statistics we mentioned earlier on to almost more than half. Number two is that we try to make sure that all pregnant women are getting a dose of Fancida plus other things that are used in the prevention of malaria in pregnancy. Number three is universal access of nets. And recently we finished, actually last month, but one, the president closed in the distribution of the universal net coverage.
In our future story today, Jennifer Oyela, who lost her son to malaria, says never again.
I'm Jennifer Oyela with my mother, Ajuang Margaret. We are 8 of us in the house. And the problem really which we've got within the locality, sanitation, water. Mosquito net is a much essential whatever, or the problem we are really facing. That's why the malaria has become, it is on a rampage. It's because of mosquito net. Last time when they were giving out mosquito net, I had lost one of my child. We'd gone to the village, so we never got it. That kid who died is of 8 of age. And even I took him, that was KCCA clinic, Lamela, Nagoro. So after that, it was not only me who was suffering from that, but we are many who are suffering from that.
You are watching the DocTalk Show.